Hey, wealth warriors, are you ready to redefine wealth and master your money mindset? Welcome to Women of Wealth. I'm your Gen X host, Holly Woods Gray.
And I'm your millennial host, Ali Ramo.
Today we will be talking about the Linqqs Health Management Plan.
What is the Linqqs Health Management Plan, Holly?
Yeah, so health management plans have been around for a number of years. They started through the Affordable Care Act and have been updated through legislation since the time that the Affordable Care Act went into existence back in 2012. And so, what it is at the time, Michelle Obama was the first lady, and her platform was to help the workforce of America become healthier. So, it's a health and wellness plan that allows for you to have benefits like no copays, free prescriptions, 24/7 teledoc, which is very helpful. You know, if you have kids or maybe you have a stubborn spouse who never wants to go to the doctor, but at 3 o'clock in the morning is when their pain tolerance is at its limit. And so a virtual 24/7 medical, being able to talk to a nurse practitioner or doctor at that time is very helpful for those of us who have stubborn spouses. You don't know anything about that, right, Allie?
I think I am that stubborn spouse.
Oh, really? Okay. So you're the one who doesn't like to go. Okay, well, at 3 a.m. in the morning, then now you would have access to something that would provide you with, some great telehealth that would tell you whether or not you need to get to an urgent care or you need to get to a hospital. And that's very helpful for people. So that's a little bit about it. What's unique about the Linqqs Health Management Plan is it not only combines those health and wellness that we just talked about, but it also saves the company money, and that money is redirected into the employee's retirement account through a SEP IRA, and it also generates money for an FSA account, a flex savings account, so that the employee can purchase things like Band-Aids and sunscreen and all those things you buy at a pharmacy that you don't necessarily have a prescription for, but that is for your health and for your wellness.
I've even noticed lately when ordering like my probiotics or, supplements on Amazon that there's a little FSA approved little message on there too. So you'd be surprised what you can use. And this is pre-tax dollars that you're using to purchase, everyday things that qualify.
Yeah, I mean, for years, our healthcare system has been very reactive. Rising premiums and copays, people missing work because of preventable illness, and also losing focus because they might have something going on, an employee might have something going on health wise, and they're just not able to focus on their job because they're worried about what might be going on. Because all of us now with WebMD and all these other search engines, we're self-appointed doctors, and so when we have some sort of symptom pop up, we usually Google it, or we go to one of these other AI companies to find out, like a chat or something like that, to find out what's going on. But wouldn't it be nice just to actually talk to a professional? There's also zero lab testing, as well as zero mental health visits, no cost for mental health visits, and a physician reviews every single plan of care, and they tailor it to the individual. So I think all of the benefits on the health side are definitely worth it. But the fact that we can now combine those retirement planning, I mean, that tends to be the two biggest problems when we're talking to employers and employees about what their employees are most afraid of in the future.
Yeah. So just to summarize is we are looking at, preventative healthcare for employees. And then also the employers get to offer some more benefits, adding to the FSAs of employees and their retirement accounts, right?
Yeah, absolutely. And so if you want to talk about who this plan is for, so first and foremost, it's for the employees. The way you would get more information about it is your employer would go through the questionnaire process and then would be on a presentation with one of our experts that will explain the entire plan. Then from there, the business owner would provide a census. Census is pretty regular conversation for somebody in the HR department. This basically takes all the employees' information, all of the details on how much money they're paying in taxes, and puts it through this system that we have to see what type of benefits and eligibility that the company would have overall. And then from there, we would have a summary of benefits, and then we would take that to the business owner, discuss it with them, and show them what would need to happen in order for their company to enroll in this program. And then the next step would be what we call open enrollment. We'd have between 4 to 6 weeks to educate, depending on how big the company is. We would educate the employees on these benefits and get them ready to sign up for it. There's no sense in signing up a company that doesn't take advantage of all of the benefits that are available. So the education piece, just like we do with the teachers right now, the education piece is very important for the employees to understand what they're getting.
There's nothing worse than having a benefit that you don't understand.
I think a
Right.
lot of people have that. I mean, don't
I
you run
think
into people, you look at their paycheck and you're like, what's this for? And they're like, I don't know. They just said it would be a good thing for me to have,
oh,
and then
all
you're
the
like,
time.
oh, well, this is a cancer policy. And actually you can get reimbursed for mammograms or for any other preventative test or whatever you may choose to do. And they're like, oh, I didn't know that. And so for years they've been paying this monthly fee and they don't even know what they get from it.
Of all my clients, I recently had one who actually knew that she would get reimbursed for that that cancer policy, and she knew what every single plan was from her paycheck, and it was awesome. But I
One
wanna
out of
say
like 500, right?
exactly. I was like, "Wow, that's amazing." And she's like, "Oh yeah, I'm on top of that. It's worth it to me." And I'm like, "Okay, amazing. I'm glad that you know what you have." I want to define employees before we move forward, because sometimes when I'm talking to businesses who contract, they think mentally that these 1099s are employees, but they're actually not. So employees are defined as W-2 employees, so they're on regular payroll.
Mhm.
And I believe there's a minimum for the LHMP that they have to make. I think it's like 5,000 a year or something
I think
like that.
it's $4,000 a year. Well, I don't think. I
Okay.
know it's $4,000 a year, and the employer must have 10 employees to see if they benefit from it. Now, we're going to say this is the way the plan is set up now. We are really working as a company, or I say we because Linqqs has been around for a while. We've been helping businesses with other types of tax credits and whatnot. And so Linqqs is really working hard to lower that number so it will be in alignment with the Secure Act 2.0, which the Secure Act 2.0 came out a few years ago, and it is bringing retirement into basically all employees. So a lot of states have adopted it. I think 18 states have adopted it so far, and many more are going to be adopting it, as well as on January 1st of 2027, it'll be a federal regulation that every company with 5 or more employees will need to have a retirement account. So this plan is compliant with the Secure Act 2.0. It's compliant with the Department of Labor, the ACA, which is the Affordable Care Act. And really, it's answering a lot of those questions that business owners have about how am I going to keep my employees, and what am I going to do to lower my workman's comp, to make sure that my employees are healthier and ready to handle the future and whatever changes the business might encounter over the next few years.
So let's talk outcomes because I know, when I've talked to business owners recently and they're smaller companies, but they're worried about the taxes they're paying, the wages they're paying. They're trying to make a profit out of their business. Obviously, it's a business for a reason.
Yep.
Let's talk outcomes of LHMP. How does this benefit the employer? Because we've talked about a lot of the employee benefits, but how does this, um, help the employer financially?
Sure. So some of the benefits for the employer is, well, one thing that really has been happening over the years is the cost of insurance has been rising and rising. So because of that, a lot of employers have had a really hard time with keeping a plan that is affordable for their employees. So because of that, there's high turnover. There is a lot of work missed because somebody's kid might be sick, and instead of them taken to the doctor, they might, just stay home longer than they normally would for the kid to run the course. So a lot of that will be taking the burden off of the employer because the employees will be working. The second thing is the proactive healthcare can actually eventually it'll reduce the healthcare costs between 20 to 30%, because when preventative care is in place instead of proactive healthcare, you're able to identify the health of your clients, and you can do what's called self-insurance instead of regular health insurance is based off of the zip code that your business is in. And so this will help them capture additional gains. And then the other thing is this is a 125 plan. And what that means, the Section 125 plan, is it means that all of the savings that are associated with this need to be applied to the employees. So if you go into a company, one of the questions that employees ask in an interview is, what do the benefits look like? Well, if you can tell them that they're going to be getting X amount of money each month for their FSA account or for their retirement account, this is going to make hiring a lot easier. And like I said earlier, retaining employees a lot easier as well. And there is some additional tax savings that is covered with each business owner. There's not like an average or anything. So you would have to get you would have to be walked through the presentation process with us in order for us to tell you what those savings would look like.
Awesome. So, how would a business owner get started if they wanted to learn more?
Well, one thing they could do is they can click the link that's going to be in the show notes. They can schedule a meeting with you or I, and we can go over the initial questionnaire. I mean, basically, the initial questionnaire asks about 4 different questions. It asks, once you get the information about the company, it asks the number of full-time employees, who their healthcare employer was, and the average salary of each employee. And then from there, what will happen is they'll be scheduled with one of our experts to go through the presentation. It takes about 30 to 40 minutes, depending on how many questions the business owner may have, to really go over the full benefit. And then from there, the next step would be to pull that census that I was talking about. So there's really, we have a very streamlined process on how to get you registered with a expert to go over that information with you. And then, of course, we hold the business owner's hand the whole way through. And then once we get to the point that we want to put it in, they want to put it into practice, then they'll work with our customer service team to get the information out to their employees so their employees can get educated on the program. And then there'll be a window that's called open enrollment, and they'll be able to enroll at that time.
Yeah, and the business concierge team will be walking you through as a business owner how to get that census and some other things. So your hand really does get pulled all the way through the process step by step so that you're not trying to figure out, because there are sometimes business owners are like, this is too much, they may think this is too much effort. I don't know where to get these numbers, or because business owners, their job is to be part of doing the business, and sometimes they're more hands-on. So if you need that extra hand holding, our business concierge team will help you get the numbers that we need, and really take you step by step through the process.
Another thing that I'm really excited about for the employees and the businesses that get on this program is there's something called a medical bill eraser and a care advocate. And it's a company that anybody can go to, but not very many people know about. And actually, I was out of town this past weekend. I was up in Bakersfield, so my brother and I were talking. Well, he happens to have a friend whose son is in the hospital. He's a baby, and he's had 2 open heart surgeries so far. And they're doing like a GoFundMe account for this child. And I was telling him that he should share this information with his friend, because even now, while they're having these hospital bills that their insurance will take care of a piece of it, but maybe it won't cover all of it, that they can start using this medical bill eraser now for them to be able to negotiate the care costs and to make it within reach for them to actually pay off. And so that medical bill eraser and care advocate, that's something that the average person doesn't know about typically. And they also don't know that there's negotiation available with hospitals and doctors that might be really on their plan. So, doctors have created these different advocacy for their clients, but it's a very small portion, because obviously doctors with a very comprehensive practice, they don't necessarily have time to explain that to everyone, you know?
I think it's really important to emphasize that piece. I mean, we talk about having life insurance with living benefits all the time because the most expensive thing isn't necessarily being injured or having a disease, but it's actually living through that injury or illness. So I think having that as a resource is huge to be able to offer people, employees.
Absolutely. And then the other thing that I think is really important is, by 2033, Social Security Trust Fund is projected to be out of money for the current people that are on Social Security. So at that point, it looks like between a 77 to 80% benefit reduction is going to start taking place. It probably won't affect the retirees, but it will affect people like me who, will be 63 at that time and looking at going on Medicare and Social Security at some point. But they may extend the qualified age out longer, like they did a few years ago, about 10 years ago. Now they changed it from 65 to 67. And I'm anticipating that 70 will be the new number. I don't know for sure. That's just what I think. But with private retirement solutions, like the ones that are included with the LHMP, it's more essential than ever for employees to start building that future because they won't be able to solely rely on those public safety nets.
Yeah. That's
And
huge.
we're hoping as we continue to provide more and more savings to the business owner, that amount that will be going in for that employee's benefit will continue to grow as the business is saving money. They'll be able to pass some of those savings on to their employees.
All right, well, millennials, so start saving for retirement right now.
Yeah, exactly.
And have a medical fund in place as well because it's going to be like 75, 80.
Yeah, you'll be working till you're 85. Thank you very much for paying for my Social Security, Allie. I appreciate that. No, I'm just kidding. But there are definitely, obviously we work with people every day on their retirement, on their life insurance, and the different programs that are available to them through their work, but also through the private side of it too. And the sooner you can start privately funding your life, the more flexibility and freedom you're going to have, and the less worry and stress you're going to have as you get closer and closer to retirement age. I mean, Social Security was never designed to be a retirement plan for everyone. It was designed back when the days of pensions were regular. Like someone would retire, they would get a pension. Only 7% of Americans have pensions now. So you see them if they're like a state employee, a federal employee, school teacher, something like that. But it wasn't designed to pay the full amount of your retirement. It was designed to make up that piece of your pension that wasn't going to be paid. So people used to work 30, 40 years at the same company. That doesn't happen anymore,
Well, and
and people used to die also when they were young. So, right.
People were living or people were living a lot less, or what am I trying to say? Younger. They were dying a lot younger. There you go.
Yeah. So when initially the retirement age was 62, a lot of people weren't even making it to 62 in order to take those benefits. So Social Security at some point was overfunded. But now people are living 20, 30, 40 years in retirement. Like let's say you retire at age 60 and you live until you're 90, that's 30 years of retirement savings that you need to make sure that you have set aside for yourself. And nowadays, like I said, only 7% of people have pensions. So I think it's really important to find these plans that are unique and they're approved and they're compliant with all the different agencies that they need to be compliant. And I'm just telling you that it's really fun to have a company that cares enough about the people who we serve that they want to go out and create a product that is specifically there to help their employees. It's compliant. It has all the bells and whistles, and it also has all the I's dotted and the T's crossed, which is something that you don't necessarily find with some of these other companies that we've worked with in the past. So I think it's really great for us to be able to offer a plan that's so comprehensive as well as so beneficial to the employees and the employer with zero out-of-pocket costs either. There might be some setup fees, but the great thing about that is because of Secure Act 2.0, if you don't currently have a plan set up, there are some tax benefits for you and it's 100% write-off up to $5,000, and I can guarantee you that it won't cost $5,000 to set up this type of plan. And there's really a zero fee, zero out-of-pocket to get started. So I think that's really powerful as well.
Yes, a win-win-win. We love those.
Yeah, absolutely. All right. So
So
like I said, if you want more information, you can go ahead and connect with us either through the links below, or you can reach us out to us on any of our social media platforms. We're happy to get you into the queue to get a presentation and find out what you qualify for. Anything else you want to add, Allie?
nope, you took the words right out of my mouth.
All right, guys, have a great day. We look forward to sharing some more information with you soon.